we are going to learn about anemia and its classification based on morphology and etiology, explaining the physiological basis of signs and symptoms of anemia. Iron deficiency anemia, its causes and physiological basis. Megaloblastic anemia, its causes and treatment. Red blood cell indices in anemia and effects of anemia on the circulatory system. Now, let's first start with definition of anemia. Anemia means deficiency of hemoglobin in the blood, which can be caused by either too few red blood cells or too little hemoglobin in the cells. On the basis of morphology and appearance of the red blood cells, anemias can be classified into 5 types, 3 on the basis of size and 2 on the basis of color. On the basis of size, normocytic, that is normal size, macrocytic, large size, and microcytic, that is small size. And on the basis of color, normochromic, that is normal color, or hypochromic, that is pale color. On the basis of etiology, anemia can be classified, that is either blood loss, decreased production, or increased destruction of the red blood cells. Blood loss can be further divided into acute or chronic. In acute blood loss, anemia develops when interstitial fluid diffuses in the vascular compartment to maintain the blood volume, but dilutes the mass of red blood cells. And chronic blood loss results in anemia when the rate of blood loss is more than the erythropoietic capacity. Deficient erythropoiesis occurs when critical nutrients such as the iron or vitamin B12 are deficient, and excess hemolysis occurs due to intrinsic abnormalities of the red blood cells or due to antibodies or an enlarged spleen. Now let's take a look on this table of morphological classification of anemia. 3 classifications are made: macrocytic, MCV greater than 100, normocytic having MCV between 80 to 100, and microcytic, MCV less than 80, where MCV is mean corpuscular volume. Here, the macrocytic can be due to vitamin B12 deficiency because of dietary deficiency, pernicious anemia, gastric resection, ileal diseases, fish tapeworm, etc. Due to folate deficiency because of dietary deficiency, drug-induced pregnancy, tropical spruce, or due to hypothyroidism and alcoholism. Whereas the normocytic anemia can be post-hemorrhagic or due to endocrine disorders like hypothyroidism, Addison's disease, hypopituitarism, or due to anemia of chronic disorders. And the microcytic can be due to iron deficiency because of dietary deficiency, inhibitory diet, hookworm, chronic bleeding, and infection, due to thalassemia, or due to hemoglobinopathy. Now let's talk about some specific causes which result in specific type of anemia, starting with blood loss anemia. After rapid hemorrhage, the body replaces the fluid portion of the plasma in 1 to 3 days, but this leaves a low concentration of red blood cells. If a second hemorrhage does not occur, the red blood cell concentration usually returns to normal within 3 to 6 weeks. But in case of chronic blood loss, a person frequently cannot absorb enough iron from the intestines to form hemoglobin as rapidly as it is lost due to these red cells that are much smaller than normal and have too little hemoglobin inside them, are then produced, giving rise to microcytic hypochromic anemia. Aplastic anemia. Bone marrow aplasia means lack of functioning bone marrow. For a person who is exposed to high-dose radiation or chemotherapy for cancer treatment can damage stem cells of the bone marrow, which results in anemia. Similarly, high dose of certain toxic chemicals such as insecticides or benzene in gasoline may cause the same effect. Also, in case of autoimmune disorders such as lupus erythematosus, the immune system begins attacking healthy cells such as bone marrow stem cells, which may lead to aplastic anemia. In about half of aplastic anemia cases, the cause is unknown, a condition called idiopathic aplastic anemia. People with severe aplastic anemia usually die unless treated with blood transfusions, which can temporarily increase the numbers of red blood cells, or the best treatment can be bone marrow transplant. Megaloblastic anemia. On the basis of vitamin B12, folic acid, and intrinsic factor from the stomach mucosa, we can readily understand that loss of any one of these can lead to slow reproduction of erythroblast in the bone marrow. As a result, the red cells grow too large with odd shapes and are called megaloblast. Hence, atrophy of the stomach mucosa, as occurs in pernicious anemia, or loss of entire stomach after surgical total gastrectomy can lead to megaloblastic anemia. Also, patients who have intestinal sprue in which folic acid, vitamin B12 and other vitamin B compounds are poorly absorbed often develop megaloblastic anemia. The treatment of megaloblastic anemia requires the replacement of folate and vitamin B12. Iron deficiency anemia. Iron is a vital element in the body because of its requirement in the synthesis of hemoglobin and iron-dependent enzymes. When iron is deficient in the body, erythropoiesis is reduced and iron deficiency anemia develops. In iron deficiency anemia, the red blood cell is microcytic with a low hemoglobin content, resulting in a microcytic anemia. On examination, patients will have pallor, but in severe iron deficiency develop spoon-shaped nails called as koilonychia. A glossy tongue may also develop. The treatment of iron deficiency anemia is by the administration of dietary iron. Hemolytic anemia. Different abnormalities of red blood cells, many of which are hereditarily acquired, make the cell fragile, so they rupture easily as they go through the capillaries, especially from the spleen. Even though the number of red blood cells formed may be normal or even much greater than normal in some hemolytic diseases, the lifespan of the fragile red cell is so short that the cells are destroyed faster than they can be formed, and serious anemia results. Now let's talk about the RBC indices in anemia. The size of the red blood cell and its hemoglobin content are often used clinically to evaluate anemia. These are called RBC indices, which can be calculated from standard laboratory investigations like a complete blood count called CBC. These are the mean corpuscular volume MCV, the mean corpuscular hemoglobin MCH, and the mean corpuscular hemoglobin concentration MCHC. The MCHC effectively correlates the hemoglobin content with the volume of cell. The RBC indices can be measured from primary laboratory evaluations of the blood hemoglobin content, the RBC count, and the hematocrit or packed cell volume, that is PCV. Here, the MCV can be deduced from the ratio of the PCV and the RBC count. The normal value ranges from 80 to 100 femtoliter or cubic microns. Values lower than 80 are considered to as microcytic and greater than 100 are considered to be macrocytic. Whereas the MCH can be deduced from the ratio of the blood hemoglobin content and the RBC count. The normal value ranges from 27 to 31. RBC with value less than 27 are considered to be hypochromic cells, and the MCHC can be deduced from the ratio of blood hemoglobin content and the PCV. The normal value ranges from 32 to 26 gram per deciliter or 320 to 360 gram per liter. RBCs with values less than 32 gram and considered to be hypochromic cells. Now let's talk about the effects of anemia on function of the circulatory system. The viscosity of the blood depends largely on the blood concentration of red blood cells. In severe anemia, the blood viscosity may fall to as low as 1.5 times that of water rather than the normal value of about 3. This decreases the resistance to blood flow in the peripheral blood vessels, so far greater than normal quantities of blood flow through the tissues and return to the heart, thereby greatly increasing the cardiac output. Sometimes it increases 3 to 4 times than the normal. Thus, one of the major effects of anemia is greatly increased cardiac output, as well as increased pumping workload on the heart. So this was all about anemia, its types and its effects on the functioning of the circulatory system. See you all in the next video. Till then, stay safe, take care. Like, share and subscribe the channel. Thank you.